Bacopa, monnieri. This is printed in the National Library of Medicine, National Institute of Health. Written by Eric A. Walker and Mark V. Pellegrini. It's in the NCBI bookshelf, a service of the National Library of Medicine, National Institutes of Health. Continuing education activity. Bacopa, often called Brahmi, is a botanical frequently used in Ayurvedic medicine. The main indications for using Bacopa in Ayurvedic medicine are memory improvement, insomnia, epilepsy, and as an anxiolytic. Many clinical studies have demonstrated improvements in verbal learning, delayed word recall, memory acquisition, and anxiety reduction with using Bacopa. It has been described as a calming, cognitive enhancer. The triterpenoid saponins are believed to be responsible for most of the herb's pharmacological actions. Bacopa has a high therapeutic index and is generally well tolerated. The most common side effects are gastrointestinal, including increased stool frequency, nausea, and abdominal cramps. This activity reviews the indications, contraindications, activity, adverse events, and other key elements of the clinical use of the herb Bacopa in the care of patients with declining cognitive performance and anxiety. Objectives: describe the clinical indications for the use of the botanical Bacopa monnieri. Discuss possible mechanisms for action for Bacopa. Review adverse effects and contraindications for the use of Bacopa. And summarize the clinical studies on the effectiveness of Bacopa in improving cognitive performance, verbal learning, delayed word recall, memory acquisition, and decreasing anxiety. Access free multiple choice questions on this topic. Indications. Bacopa is a medicinal creeping perennial in the Scrophulariaceae family with small oblong leaves and white to purple flowers, frequently used in Ayurvedic medicine. Other names for this herb include Brahmi, water hyssop, thyme-leaved gratiola, and the herb of grace. Brahmi is derived from Hindu mythology, meaning Brahma, or the supreme creator. The term Brahmi has been used to describe Bacopa, Santalacita gudicola, and a combination of the two botanicals. Bacopa is native to India, Indochina, Australia, and Sri Lanka. The leaves are used medicinally and contain triterpenoid saponins, alkaloids, flavonoids, glycosides, phytochemicals, saponin, and other compounds. The saponins are believed to be responsible for most of the pharmacological actions. Its use has been documented in the Ayurvedic text Charika Samhita as a treatment for various mental conditions. Ayurvedic medicine describes Bacopa as a Madhya Rasanya, meaning a class of herbs believed to improve mental health, memory, and intellect, and improve rejuvenation and longevity. The main indications for using Brahmi in Ayurvedic medicine are memory improvement, insomnia, epilepsy, and as an anxiolytic. Many clinical studies demonstrate improvement in verbal learning, delayed word recall, memory acquisition, and anxiety reduction with Bacopa. It has been described as a calming cognitive enhancer. Bacopa can be used on its own or in combination with other nootropic herbs such as Gudicola. Bacopa and centella both possess nootropic properties and have nootropic activity with therapeutic uses for patients experiencing memory loss. Gudicola is used in Ayurvedic medicine and in combination with other herbs in traditional Chinese medicine to combat symptoms of anxiety and depression. In human studies, Bacopa has demonstrated beneficial effects on cognitive performance, verbal learning, delayed word recall, memory acquisition, and decreasing anxiety. The FDA's position is that Bacopa products are not approved for any medical purposes, and in 2019 issued a warning to dietary supplement manufacturers who produce product containing Bacopa regarding making any therapeutic claims about the herb. Human studies. Bacopa is functioning as a cognitive performance enhancer was demonstrated in a small randomized controlled study published in 2014. They noticed statistically significant improvement in cognitive performance, mental, arithmetic, stroke, letter search, visual tracking, improved mood, and decreased cortisol response from stress after one dose of Bacopa. A stronger effect was observed with a 640 milligram dose. In contrast, another small study evaluated a daily dose of 450 milligrams for a 12-week period in healthy adults, which demonstrated no significant change in cognitive testing, learning, and memory information processing, but a trend for decreased anxiety. A meta-analysis incorporating 9 randomized controlled trials demonstrated an improved speed of attention and cognition and decreased reaction time. In a randomized, double-blind, placebo-controlled study, patients were given a 300 milligram standardized extract of either Bacopa or placebo. Measurements were obtained by evaluating tasks of attention, memory, and psychological state at baseline and following a 12-week time. Treated group demonstrated enhanced delayed word recall memory scores and an increased ability to ignore irrelevant information relative to placebo. In a study of memory acquisition, there was a randomized double-blinded study that reported a 12-week cycle of Bacopa significantly improved memory acquisition and retention in healthy older Australians. A meta-analysis incorporating results from 6 studies with 12 weeks or greater duration found that Bacopa improved memory-free recall but did not improve other aspects of cognition. These studies used a 300 to 450 milligram dose of Bacopa extract standardized 10 to 20% Bacopa glycosides. Bacopa shown anxiolytic effects in people with cognitive decline. Bacopa combination with Gudicola has been shown in double-blind randomized clinical trials to effectively reduce general anxiety symptoms. Animal studies. In a study on male albino mice, Bacopa extract was administered along with in a second week of 2-week trial. There was a significant reversal of phenotype-induced cognitive impairment with improved acquisition and retention of memory and no effect on the anticonvulsant activity. Some animal studies suggest a benefit from Bacopa for Alzheimer's disease, epilepsy, Parkinson's disease, and cerebral ischemia in part. It's been shown to cure gastric ulcers in animals and have anti-Helicobacter pylori activity in human colonic tissue. Mechanism of action. Bacopa monnieri has many pharmacological actions, including antioxidant, anti-inflammatory, anticonvulsant, cardiotonic, bronchodilator, and peptic ulcer protection. The leaf powder Bacopa has been shown to have antioxidant effects. The cognitive enhancing properties of Bacopa are likely from the presence of a group of saponins collectively referred to as bacosides. Purified bacosides A and B, as well as Bacopa alcoholic extract, may facilitate learning ability, memory, and cognitive performance. Some possible mechanisms which may lead to cognitive improvement include modulation of acetylcholine release, muscarinic cholinergic receptor binding, and choline acetylase activity. The saponins in Bacopa modulate hypothalamic pituitary adrenal HPA axis output and protect the hippocampus. Bacopa causes an anti-inflammatory effect on activated microglial cell cultures. The microglial cells respond to any injury by transforming it into either a neuroprotective or neurotoxic phenotype that releases pro-inflammatory cytokines. In one study, tea infusion and alkali extracts of Bacopa, as well as Ecoside A administration, was shown to significantly inhibit the release of TNF-alpha and IL-6 from activated N6 microglial cells in vitro. Other research demonstrates several mechanisms of action, including acetylcholinesterase inhibition, beta-amyloid reduction, choline acetyltransferase activation, increased cerebral blood flow, and monoamine potentiation. Many neuroprotective aspects of Bacopa have been studied. Bacopa has been reported to protect against oxidative damage via decreased protein carbonyl levels in both cytosol and mitochondria in all brain regions. There is evidence of the inhibitory activity of Bacopa in the prevention of lipid peroxidation in the prefrontal cortex, striatum, and hippocampus of rats. In the presence of free radicals, the first line of defense is the antioxidant superoxide dismutase, which increases with oxidative stress. One study reported decreased superoxide dismutase activity to normal levels in treated diabetic rats. This suggested homeostasis between the oxidant and antioxidant species. Reduced glutathione was significantly depleted in diabetic rats compared to non-diabetic rats due to oxidative stress. Bacopa has been reported to increase the level of reduced glutathione. Catalase is a common antioxidant enzyme found in nearly all living organisms exposed to oxygen. The age-associated decline in the catalase activity in the lymphocytes of middle-aged and older male rats was significantly increased over those who received Bacopa treatment. In animal tissue models, Bacopa was shown to increase the adaptation response to stressors. It normalizes monoamine levels and corticosterone in experimental models of stress. The sedative actions of Bacopa led to an overall calming effect. Bacopa has been shown to support GABA production, which reduces non-excitability, thereby improving rapid response decision-making. Gamma-aminobutyric acid, GABA, is a neurotransmitter that provides a calming effect on the brain. Bacopa has been shown to increase GABA by enhancing the GABA-A receptor subunit and upregulating glutamate decarboxylase. Administration. The typical dose range of Bacopa used in traditional medicine and modern clinical trials are crude herb 5 to 10 grams per day of herb, taking in 2 or 3 divided doses. 1 to 5 tincture, 10 to 20 milliliters per day, taken in 2 or 3 divided doses, or an extract, 300 to 400 milligrams per day extract, usually standardized to 24% to 55% biocides for adults. Bacopa may be used for up to 6 months at a dose of 225 milligrams daily in children 6 to 12 years. Adverse effects. Bacopa has a high therapeutic index and is generally well tolerated. The most common side effects are gastrointestinal, including increased stools frequency, nausea, and abdominal cramps. These are believed to be secondary to the upregulation of acetylcholine activity and/or saponin-mediated gastrointestinal tract irritation. One study reported that Bacopa extract could also decrease fertility in animals. Libido was unaltered. However, there was a decrease in sperm count, motility, and viability when a dose of 250 milligrams per day was administered for 28 and 56 days. Bacopa is mildly sedating and may contribute to anxiolytic activity. Contraindications. Bacopa may inhibit the acetylcholinesterase enzyme, which may result in increased acetylcholine levels. As a result, Bacopa could counteract the effects of anticholinergic drugs and may worsen bradycardia. and exacerbate conditions such as gastrointestinal obstruction, peptic ulcer disease, pulmonary conditions such as asthma, chronic obstructive pulmonary disease, or urogenital tract obstruction. Bacopa has been shown to inhibit human cytokine enzymes, which could contribute to herb-drug interactions when co-administered orally with medications metabolized by CYP1A2, CYP2C9, CYP3A4, and CYP2C19. Animal research suggests Bacopa may increase thyroxine levels T4 in mice by about 40%. It should be used cautiously or avoided in those with a thyroid condition or those who take thyroid hormone medications. Monitoring. Studies demonstrating adverse reactions to Bacopa are limited as is writing. No significant documented adverse drug reactions or side effects have been demonstrated in clinical or biochemical measures in humans. One study documented a decrease in appetite and mild elevation in albumin, aspartate, aminotransferase, uronitrogen, globulin, and sodium in rats when they received a dose of 500 milligrams per kilogram. But there was no significant change in the weight of organs at the end of the 90-day study. Another study found Bacopa causes reversible suppression of spermatogenesis and fertility in Parkes strain mice without affecting libido or producing toxic effects. There have been no human toxicity demonstrated with the use of Bacopa in humans. One study evaluated the effects of large doses, 30, 60, 300, and 1,500 milligrams per kilogram administered to Sprague-Dawley rats over a period of 270 days and do not produce any significant toxicity. Enhancing healthcare team outcomes. Individuals should communicate to their primary care provider when taking Bacopa. The provider may need to discuss this with the pharmacist regarding other medications the patient is taking. Bacopa has cholinergic properties and may increase the chance of side effects with cholinergic drugs due to an additive effect. Bacopa may also decrease the effectiveness of anticholinergic medications such as atropine and belladonna alkaloids. Bacopa is known to cause non-competitive inhibition of several cytochrome P450 enzymes. This may cause increased accumulation of medications broken down by this enzyme and decreased rate of formation of active breakdown products. This may alter the effects and side effects of these medications. T4 concentrations was increased with the use of Bacopa extract. Consuming Bacopa concomitantly with thyroid hormone may result in too much thyroid hormone and increase the potential for adverse effects.